Hi guys, hope you are doing great. Today let's start with the NBME 15 review. Like previous, I have divided this section into green, blue and orange section followed by uncolored portion. Let's start with the green. And a side note before starting this content review, I haven't included all the 200 questions from the NBME 15. I just included those which I feel like I need to review again and again. In this video, I have included like around 60 to 70 points. It takes around roughly 15 to 20 minutes. Okay, let's start with the green section. Antibiotic prophylaxis is not required in case of GI-GU procedures or vaginal and C-section procedures. This is in context of infective endocarditis. Here is a small table from UWorld. You need not to give antibiotic prophylaxis for GI-GU procedures in the absence of infection, but you need to give antibiotic prophylaxis for GI-GU procedures in the setting of active infection. You need to give like ampicillin or amoxicillin if given in the options. Other conditions where antibiotic prophylaxis is required is surgery on infected skin or muscle, respiratory mucosal incision, and tooth manipulation. This is a very high yield table. And the next point is bleeding from IV lines or catheter sites. Okay, in this NBME, I have seen this statement given in this question. Immediately, usually we think of DIC by seeing this like bleeding from IV lines or catheter sites, but this is not the case scenario here. In this case, I remember like a patient was getting around 10 units of PRBC transfusion, so there was dilutional thrombocytopenia. This is the case scenario here actually. So the patient is having bleeding from IV lines, so immediately we have to like think of thrombocytopenia. The ideal solution is give blood transfusion. If you are giving massive blood transfusion, ensure that the ratio is 1:1:1, that is PRBC is to FFP is to and platelets. And the next point is septic pelvic thrombophlebitis doesn't have uterine tenderness or foul smelling lochia, and cultures are negative, and this is a diagnosis of exclusion. This usually presents 5 to 7 days after the initial vaginal or cesarean section. The treatment here is anticoagulation. Antibiotics do not work, and sometimes we can give. Okay, and the next point is amniotic fluid embolism occurs during labor, immediately postpartum, or during cesarean section. It cannot, like, it doesn't usually occur during surgery for ectopic pregnancy. Periop cefazolin should be administered within 60 minutes before the first incision. If surgery is delayed beyond that window period, repeat the cefazolin of same dosage immediately before proceeding. For example, a surgery was planned at around 10:30 a.m. and we have given the initial dose at 10 a.m. But however, in this case, the surgery was postponed to 3 a.m. due to an emergency for the orthopedician or whoever it may be. So the surgery has to occur at now 3 p.m. So we need to give another dose at between 2 to 3 p.m. Okay. This is a case scenario of a recurrent UTI. A patient came to the office with complaints of recurrent UTI 3 episodes per year, more than 3 episodes, and she's planning to go to Southeast Asian country for a military deployment. So she was asking for what can be done to or what can be done to ensure so that the chance of getting UTI is low. So the best possible option is provide a self-start antibiotic nitrofurantoin with clear instructions rather than relying on like options like cranberry juice or changing contraception or continuing empiric prophylaxis. This is called self-expedited therapy. Usually USMLE generally avoids options like generally hates options like cranberry as the correct choice in their MCQs. So please be careful with that. And the next question is about the PCOS. In PCOS, LH is elevated, FSH is normal. In this question, this is the actual answer. HbA1c can be measured to evaluate diabetes mellitus, but usually we don't measure estradiol or androstenedione. We measure testosterone and LH. Okay. The next one is emergency surgery plus broad spectrum pre-op antibiotics. Okay, what is the best possible antibiotic that we can give in this scenario? The answer is cefoxitin, because it covers gram-positive organisms, enteric gram-negative rods, and anaerobes. And let's deal with the blue section. If the glabellar or palmomental reflex are present, it highly indicates a frontal release signs or a frontal lobe dysfunction. If the case scenario is of hypocalcemia, this is the sequence we need to go in the diagnostic evaluation: remeasuring calcium, albumin, magnesium, PTH. But the same scenario doesn't work for hypercalcemia. In this case, you should go for PTH levels. Okay. Contaminated soap in the hospital setting causes outbreak of Pseudomonas serratia or and Burkholderia. Just a factual point to remember. I have seen this first time in this NBME. Even I don't know this. Medical abortion done with mifepristone or misoprostol, and severe shock occurred immediately postpartum. I mean post-abortion. What is the most likely organism involved here? Most likely bug involved here is Clostridium sordeli. Women with GDM are at risk of type 2 diabetes mellitus, so monitor with the HbA1c and fasting blood sugar during follow-up. Cirrhosis. Cirrhosis, the coagulation factors are consumed, so the PT-APTT is elevated, and there is decreased production of thrombopoietin, so the platelet count is decreased. Next, coming to the orange section. Before growth hormone supplementation to anybody, first we need to evaluate whether the growth plates are fused or open. If the growth plates are fused, there is no point in supplementing growth hormone to the person who need it. If the growth plates are open, okay, of course, like it works for that person. Head trauma can cause secondary normal pressure hydrocephalus. I have discussed this before. Peripheral arterial disease, and the patient has like surgery, and the most common post-op complication associated with this patient is increased risk of MI post-surgery, and the PAD, coronary artery disease, and the CVD, cerebrovascular, the pathogenesis, underlying pathogenesis is same. A patient have decreased tympanic mobility on pneumatic otoscopy, tympanic membrane erythema and bulging. The diagnosis here is acute otitis media. In case of otitis media with effusion, there is no tympanic membrane erythema, or this point you need to note. This point is not present. I mean this feature is not present in effusion. Okay, otitis media with effusion. During pediatric visits, if a parent demonstrates depressive symptoms, the appropriate recommendation is evaluation of the parent for depression, not treatment of a normal child. So we need to refer the mother to psychiatric evaluation. Pregnancy of 10 weeks plus macrocytic anemia plus poor folate intake plus celiac disease. Folate deficiency, its deficiency during early pregnancy like around 3 to 4 weeks can cause increased incidence of fetal neural tube defects. Ductectasia usually presents with green discharge, but not always. Okay. Uh, Instead, they can give like a brownish discharge or reddish bloody discharge, sometimes associated with nipple tenderness and peritectal inflammation. Okay. Emergency surgery. If the patient was in full stomach under GA, there are chances of aspiration. So this leads to mechanical obstruction in the airway, and this leads to low SpO2 despite 100% oxygen. So the best intervention to do here is do a bronchoscopy and clear the debris. Doing tracheostomy without addressing the actual cause is futile here, and no need to remove endotracheal tube prior to doing bronchoscopy. The next statement is patient is having atrial fibrillation, and he's under the treatment of beta blocker therapy, and he's having a bradycardia. What is the most important treatment here is to remove the offending agent, and after eliminating the cause, if atrial fibrillation later occurs, then you can treat the atrial fibrillation with other agent like a calcium channel blocker. After removing this agent, if the bradycardia persists, you have to go with the pacemaker. Staph aureus outbreaks in hospitals are far more commonly spread by transient colonization of healthcare workers' hands more than the contaminated furniture. In any patient with syncope plus late peaking right upper sternal border systolic murmur, soft or absent S2 and pulsus parvus et tardus, the diagnosis is severe aortic stenosis, even if the episode was triggered by standing. Heart murmur overrides orthostatic hypotension. Usually on standing, venous return reduces, cardiac output reduces. Acute increased airway resistance. This is the classic NBME code for bronchospasm, wheezing, laryngeal edema, and refractory hypotension can occur in anaphylaxis. Whenever an effective treatment already exists, a randomized control trial should compare the new therapy with the current standard of care, not placebo, because withholding proven therapy is unethical. Brain tumor plus vasogenic edema plus focal deficit, anticonvulsants is the management for seizure. Then immediately give dexamethasone. Reserve mannitol for impending herniation, not routine tumor associated edema. Ultrasound difference less than 3 weeks in the third trimester, just reassure. A 17-year-old with obesity, a parent with hypercholesterolemia and premature paternal MI should undergo lipid screening now. Next, let's go with the uncolored portion. Patient of osteoarthritis said, I don't want any more pills initially, later but he continued to take them and improved. So what is the next best step of management? Continue the same regimen. Iritis is also known as anterior uveitis, sudden severe pain plus anterior chamber clouding plus photophobia plus normal intraocular pressure. It is anterior uveitis. Atypical ulcers, painful, rapidly enlarging, unusual appearance. Biopsy them first. Rheumatoid arthritis can cause vasculitis ulcer, but biopsy is mandatory. Don't directly go for treatment like steroids here. Flashbacks, trials, after images, inside preserved, geometric patterns. This is a classic scenario for LSD. Every woman with suspected PCOS hyperandrogenism should have a serum 17 hydroxyprogesterone measured to exclude non-classic congenital adrenal hyperplasia before diagnosing PCOS. HIV partner disclosure, encourage the patient to inform partner. Then you have to go for public health reporting. They will take care of partner notification if the patient has not informed to her partner. Poison IV, post exposure, what is the best next step to do? Wash the skin with wash the skin with soap to prevent skin reaction. If the reaction has already developed, then you have to go for topical steroids. Effusion plus inflammation, acute otitis media, but effusion without inflammation, otitis media with effusion. I have discussed this already. Most common cystic fibrosis pathogens in young child is Staph aureus. In older child that is more than 15 years, the answer is Pseudomonas. Inhaled tobramycin can cause chronic, can be used for chronic Pseudomonas suppression. Paronychia, infection around nail fold and cuticle. Puncture wound plus fusiform swollen finger held in flexion. Pain with passive extension. It is classic for canaveral sign and it indicates pyogenic flexor tenosynovitis. The treatment here is urgent IV antibiotics and surgical evaluation. Hematuria plus hearing loss plus anterior lenticonus plus end-stage renal disease in maternal uncle. The diagnosis here is Alport syndrome. Treatment is ACE inhibitor to slow the progression of disease. Dialysis and renal transplant is reserved for refractory cases. 1 to 5 days after upper respiratory tract infection, the diagnosis is IgA nephropathy, whereas 1 to 2 weeks after upper respiratory tract infection, the diagnosis is post-streptococcal glomerular nephritis. Different doctors legitimately choosing different acceptable treatments for a disease. It is known as variation in utilization. Error plus no harm, it is near miss, versus error plus patient harmed, it is an adverse event. Stable angina, ECG comes first always. If the patient can exercise, then do exercise stress test or imaging test. ROGAM is only reserved for RH negative females. Check out if the mother is RH positive. If the mother is RH positive, then don't give ROGAM. Complete abortion, all products are expelled and closed os and bleeding is resolved. Reassure and follow up in 1 week. No routine ultrasound or DNC. Beta HCG above the discriminatory zone plus the uterus is empty. It is ectopic pregnancy until proven otherwise. 15-year-old plus bloody nipple discharge plus nipple tenderness plus no mass. It is not breast cancer. If the option is intraductal papilloma, go for it. If that is not in the option, then go for ductectasia. Midodrine treats orthostatic hypotension. For STI exposure, trust the patient's history unless there is a reason to doubt it. Do not delay empiric treatment by contacting the partner's physician. Partner got treated with chlamydia, treat your patient for the same. If it is for gonorrhea, treat your patient for same plus chlamydia also. Acute lymphoblastic leukemia can cause diffuse bone pain, osteolytic lesions, periosteal reaction. Consider doing bone marrow biopsy here. MRI doesn't help. Aortic stenosis can cause syncope, angina and dyspnea. This is not that important, just go through this once. Chronic steroid use plus stressor like surgery, illness, trauma and infection. Then vasopressor resistant hypotension was there. Go for IV hydrocortisone. The diagnosis is adrenal crisis or insufficiency. Child with cerebral palsy. The question is asking about the child's education. Provide education to child in a least restrictive environment possible. A regular classroom plus accommodations if needed. First line for iron deficiency anemia is oral ferrous sulfate. Parenteral is reserved for malabsorption or intolerance. Transfusion is reserved for less than 7 grams. Alpha-1 antitrypsin deficiency should be suspected in young patients who present with bibacillar emphysematous lung changes in the absence of smoking history. They are at risk of chronic liver inflammation and developing cirrhosis. Whenever a meta-analysis relies only on published studies, think publication bias. The tendency for positive studies to be published more often than negative or neutral studies, leading to an overestimation of treatment benefit. Extremely premature born before 22 weeks, there are very low chances of survival, so consider palliative care. Specific phobia, the treatment is CBT, graded exposure therapy, uh, more than like better than medication. If there is no access to CBT, go for benzos. Mass is suspicious for malignancy, merit histopathological diagnosis regardless of pregnancy status. Aortic dissection, first do the BP control, labetalol or nitroprusside is used. In case of descending thoracic aortic dissection. Type 1 diabetes mellitus require insulin supplementation. Patients with xeroderma are at increased risk of squamous cell carcinoma. Timeouts involve reviewing the patient's name, the procedure, the anatomic location of the procedure. Hypothyroidism can cause increased risk of hypercholesterolemia. Testicular torsion, there is increased risk of infertility and testicular cancer. Neisseria meningitis can cause diffuse purpuric rash. Thank you.